how can we overcome depression, anxiety, and maybe there are people who are not feeling good enough?
Well, again, when you talk about self-love, right? Self-love comes from within us. So it's a lifestyle that we have to adapt and be able to give ourselves credit to love ourselves. That's the number one. Because a lot of times, if you're not growing up in an environment or you're around people, I always say the power of association is so important. That we need to be able to surround ourselves with like-minded people and to give ourselves the credit for self-love. Now, as far as, okay, I was going to talk about, sorry, maybe I'll just ask you your question again, because I'm going into a few different directions.
So how can we overcome anxiety and depression? What
Okay.
can we do? Maybe there are people from our audience who have depression and anxiety. What they need to do? What are the steps to overcome this obstacle?
Sure. And that's a great question, because sometimes we don't know what it is. We may have depressive symptoms, but to be clinically diagnosed, we use what we call a DSM-5. It's like our psychiatric Bible to diagnose. Now, I also tell people, don't get caught up in the diagnosis. It's just a tool so we know that we're treating you appropriately. So in order to be diagnosed with depression, you have to have symptoms for a minimum of 2 weeks. And often people have had those symptoms long before that, right? People live in isolation for decades, sometimes with mental illness. So depression is some of the symptoms I talked about earlier. Anxiety is interesting because we kind of lump anxiety in one, but technically up till recently, there was 8 different types of anxiety disorders. And more recently, we took out post-traumatic stress disorder and acute stress and OCD out of the anxiety disorders. So there's actually 5 types of anxiety: generalized, agoraphobia, panic disorder, social, and specific phobias. So again, everyone's going to present differently based on what type of anxiety they have. But often people refer to generalized anxiety. So we have this hypervigilance. So we're always anxious. I like to use the example, how many of us have lost our keys? And I know both of you are traveling, so right. And or we think we mislocated our passport. That feeling you get, right? That instant feeling, that fight or flight, that's the sympathetic nervous system kicking in. So our brain is telling the rest of our body there's a sense of danger, whether it's perceived danger or real danger. But once you find your keys or your passport, your body goes back to a resting state. But here's what's different with people living with anxiety. They never get that real resting state. There's always that elevated level of anxiety. Even when things are going well, people will say, I feel like something bad is going to happen. I feel restless, something, I just don't know what it is, but I just can't settle. So that's a little bit about anxiety. So where do they go for help? I would say to seek professional help and find the experts that work in the field. A lot of times we just go to the doctor and we take their advice and we do what they say, but we don't really inside, we don't feel good about it, or we don't really understand why we're doing what we're doing. So I always tell people, interview your therapist, find out what they do to treat anxiety and depression, if that's what it is. But I think the first step is getting properly diagnosed. Because if we don't, then we get on the wrong treatment, sometimes the wrong class of medication. And medication can help a lot. We use what we call SSRIs to treat anxiety and depression. And those are things medication that helps fire those neurons regularly so we don't have this hiccup in the brain and we keep going back to our negative self.
So my next question for you is, if we are taking the treatment, can we heal and be in a good place in time to give up on the medication? Can someone heal from anxiety and depression?
Is it possible?
Yes, you can. Yeah, sorry, what was that?
If it's possible.
If it's possible.
Yeah. I think everyone's so individual. And even when we talk about medications, what works for you may not work for me and vice versa. So it's trial and error, finding the medication that works, titrating up on the medication slowly and gradually until you get to what we call a therapeutic level. And then people can often see things differently. I think we view things through a different lens when we're anxious or depressed. And then after you get settled and on that therapeutic dose, you're able to see things differently. And as far as coming off the medication, that is so individual. I have clients that come right off the meds over time, and then I have clients who just stay on a lower dose, and it sort of just maintains their mood and their anxiety is controllable. Now, medication only is responsible for 40 to 50% of improvement. The rest is our behavior. The rest is our self-talk, our self-love, doing the therapy to make the change, because the brain has to have that pivotal shift, and we have to do it through repetition and be able to view things differently.